Welcome to today's Meet a Vendor webinar hosted by me, Salud. I'm Christy Doe, Shortlister's Meet a Vendor webinar moderator, and I'm so glad you could join us today. Before I turn things over to today's presenters, I'd like to review a few quick housekeeping items, especially for those of you who may be first-time attendees. Our Meet a Vendor webinars take place on Wednesdays at 1 p.m. Central Time. We use a condensed format of 30 minutes, and that includes a 25-minute presentation followed by 5 minutes of questions. To submit a question, use the question box at the top of your screen. You should see it right at the top of the screen. Type it in, send it over to me, and we'll get to as many of those as we can in the time that remains after the presentation. For our subscribers, our webinars can be found on our website. So if you head over to Salud's vendor profile, you can find it there. So with that, I am going to hand things over to today's presenters. We have Sarah De La Cerda, Senior Program Manager, Mental Health and Wellness, and Jim Shields, Director of Sales with Me Salud.
All right, well, thank you, Christy, and thank you everyone for joining today. I'm really excited to talk about this topic, building better telehealth for bilingual blue-collar teams. Again, I'm Sarah De La Cerda, and I'm joined by Jim Shields.
Hi, everybody.
All right, next slide. And so, I'm going to start off as we're kind of moving to the next slide is we know our workforce is evolving rapidly with Latinos making up 78% of our net new workers. And we see the staggering statistic, $528 billion annually in avoidable healthcare costs. And that tells us something. That tells us the system isn't evolving fast enough to meet the needs of a changing workforce. And this isn't just a number, it's a direct financial understanding of the impact of low engagement and non-adherence for this population. Additionally, Latino culture is diverse, meaning simple Spanish translation is not enough. Factors such as low health literacy, complex social determinants, and cultural distrust are major contributing factors to the low engagement and non-adherence. And so I want to take a little time to look at what does it look like, truly on the ground. We have the number 528 billion and we have non-adherence, all these words, but what does it look like on the ground? What happens in the day-to-day experience when our healthcare system is still primarily designed for a very different population, a population that speaks primarily English, who's health literate, and who are already motivated to seek, their care or, whether it be physical health or mental health. So I'm going to start by sharing a story that illustrates the challenges firsthand, and also a story that ultimately led me to working with Me Salud. So let's meet Luis. We see here Luis. He's a dedicated blue-collar worker in a manufacturing plant covered by excellent traditional health insurance. And lately, he's been struggling with unexplained fatigue and irritability at work. These are classic signs of blood sugar that's being unmanaged. And Luis knows he needs help. So here's how the system immediately fails him across multiple critical barriers. First, we see the logistical and linguistic wall. Luis tries to call a primary care provider on his insurance card, but the staff only speaks English. So Luis, a primarily Spanish speaker, struggles to communicate, and then he's told the doctor isn't even accepting new patients, and then is vaguely redirected to another English-only line, and he hangs up, just feeling defeated. So this isn't just a language barrier, it's a logistical barrier. It's a barrier to access, leading to immediate non-adherence to the system. So next we come up against a cultural and trust gap. Frustrated, Luis turns to a coworker who suggests a special supplemental energy. And Luis, lacking reliable health literacy and lacking a trusted source within the healthcare system, he tries it. Now, this isn't a failure of Luis's intelligence. It's a failure of trust and cultural relevance. The system didn't give him a path that he could access and that he could relate to. So his actual diabetes continues to go undiagnosed, and the adherence to any real treatment plan really can't begin. And now we're hitting a telehealth gauntlet. We're going to hit the logistical, the technical, adherence, and linguistic. Desperate, Luis eventually navigates to a telehealth appointment, but the first available slot is a month out. and this conflicts with his work schedule. He takes it and kind of scrambles to adjust his shift and relies on a coworker to help cover. And this is stressful. He's kind of having to share a little bit more than he normally would. And he's really stressed about that 30-minute virtual session. This highlights a logistical nightmare for a blue-collar worker. He's struggling to find a private spot. He can't go to his car. It's parked really far off. And so he just settles for a noisy storage closet. And now he's in the closet and he's facing a technical barrier. He's trying to log in to the complex app, already overwhelmed. He makes it into the app. He finally logs in, only to wait 20 minutes for the doctor to show up on his screen. And when the doctor shows up, they speak Spanish, but they're not fluent. So Luis is now anxious about the time. He has 10 minutes left. His coworker's covering. He has to get back on his shift, and he tells this to the doctor. And the doctor kind of casually explains, well, it's our policy. We can, we have up to 30 minutes after the appointment time to log on. And so if you need to reschedule, we can reschedule. This is part of the grace period that we have. Now, this is just a catastrophic failure in linguistic fluency and active adherence. He technically got access, but the experience was so poor, it actively pushed him away. So defeated and disillusioned, Luis completely gives up on formal care. His diabetes is compounded by anxiety and sleep issues now, and he's just kind of spiraling. He's making more mistakes at work, has more conflicts, and is increasingly disengaged. His employer is now looking at rapidly escalating claim expenditures, lost productivity, and potential safety risks, all because the promised benefit wasn't really accessible or culturally relevant to Luis. And this is the outcome of hands-off telehealth. It places the entire burden of navigation and adherence on an employee who's already facing overwhelming barriers. And this is exactly the scenario I witnessed countless times when I was a provider in a large HMO. I was one of the few Spanish-speaking clinicians in that setting, and I didn't just see these failures, I felt them. And it was this profound disconnect that prompted me to leave and join Mi Salud. And here at Mi Salud, we are designed to intercept and support workers like Luis from the very beginning and navigate these walls for them. So how does Mi Salud overcome these challenges? It's activation, not just access. We start with that fundamental shift. We don't just provide a portal, we build trust in person and set foundational health goals. So our approach is built on three core pillars. One, building trust in person and setting baselines. For most clients, our partnership begins with the on-site health fair at the job site, and this is crucial. Here at Mi Salud, our coaches conduct screenings in Spanish. There's labs that are drawn, and they're even given their results in Spanish. And there's face-to-face interaction that allows for private discussion of results, engaging the patient in personal health setting goals right away. Critically, we also provide in-person registration and app support to completely overcome those initial technology barriers that we discussed Luis kind of coming up against. And this is where the relationships are established, by laying the groundwork for ongoing telehealth care and ensuring that trust is built from day one. The second pillar is flexible on-site collaboration. So we don't just parachute in, we partner with each client to co-create regular on-site programming. This ensures our initiative, whether it's health fairs or on-site clinics, or we even have a really fun Biggest Changer challenge that a lot of people on one of the sites we do get really excited about. This complements the employer's existing goals and their culture. And crucially, this employer-sponsored benefit is made available to any employee, full-time, part-time, seasonal, regardless of your insurance coverage or status. So that really maximizes reach across your entire workforce. For example, Luis's scenario, let's say he didn't even have health insurance, but his employer had Mi Salud, and he's noticing new symptoms. He comes to our on-site onboarding. We're already getting him connected to care. He's already be able to get more information, and I'll talk a little bit more about that later. And then the third pillar, telehealth made for employees. So beyond initial trust building, we deliver truly accessible telehealth made for employees. And so this means same-day access to live health coaches who employees get to know and can choose. We offer flexible options, so video consults via app, phone calls. For some folks, don't even have a phone that has access to kind of an app setting, so they still have the flip phone once in a while, and we can do solo teléfono. We do phone calls to provide their care, and even text. There are no copays, and we have extended virtual clinic hours to fit the blue-collar schedules. And the critical piece to this is our native Spanish speakers also speak English. So it really ensures that deep linguistic and cultural connection is maintained in every interaction and eliminates the kind of misunderstanding Louise faced. And this integrated approach, that in-person trust building, collaborative programming, and truly accessible, culturally fluent telehealth is how Mi Salud ensures high engagement and drives real health outcomes. And another piece to this puzzle, is we understand that oftentimes the most crucial piece of adherence, with this moving variables is often happening in between appointments. So we've designed AI to address the gaps that occur in the hours in between those sessions. And we do this by going beyond the industry standard. So for example, currently the industry standard is AI scribes. They're becoming more commoditized. You see them major EHRs, and that's being integrated more. And then but the challenge is the current AI focus is primarily on operational efficiency. So maybe increase patient panels or reduce the documentation time, but it's really missing the focus of the actual user experience, the providers and the patients. So Mi Salud has designed their AI for engagement and trust. The provider focus improvements allow for easier tooling to build trust. There's required safeguards that require the provider to review and approve their note and edit it before it moves forward, and also clear positioning as assistance, not replacement. There's also patient-focused literacy optimization, which is personally my favorite part. It converts clinical language to accessible explanations, and this helps target the blue-collar workers. An example of this is, I also provide some support. I'm a licensed clinician and can provide some support when needed for certain clients. And I can adjust the language. So if someone is lower literacy, if they're, sixth grade reading level, I have functions in my documentation where I can adjust that so that when they get that note and they're looking at their own note and they're taking it to their doctor to kind of help bridge the gap, they're able to understand what it says, because it's not only in Spanish, but it's also in a health level that they understand. And I can also adjust it from English to Spanish as well. So it's translating healthcare, making sure that doctors' orders are understood and followed by those who need it most. I'm going to share with you what we've kind of started to unveil is our AI nutrition agent. And it's a specific example of how we've leveraged AI to address aspects of care that are often, kind of gaps in other areas. Through our AI nutrition agent, we're able to develop tailored plan for real lives. Our health coaches are able to address factors such as social determinants of health, cultural food preferences, economic constraints. They're able to address, factors, within social determinants of health, such as, if Luis, again, was our client, what's his kitchen availability look like? Does he have a microwave versus full kitchen? Because the foods you're going to cook are going to look different, based on that. And the recommendations for foods are going to be different from the health coach's perspective. Work schedule. So sometimes people have single jobs, there's multiple shifts. That's going to affect, like, do you have to pack in lunch, or what does that look like? Housing situation. For cultural food preferences, recent immigrant versus generational Americans. There's going to be different diets that even happen between Mexican, Venezuelan, or even some folks, prefer that Mediterranean diet. There's economic constraints. If someone has limited budget, we can make the most beautiful nutrition plan for someone, but they're not going to be able to follow it if it's not falling into that budget. And also thinking about, are they planning for themselves? Are they planning for a family? And there's real-time adaptability and feedback in this process. We're taking the patient feedback. This worked for me, it didn't. Real-time adjustments for things like high egg pricings during the bird flu, or even preference modification. Some people just don't like onions, and we can adapt for that too. This is a dynamic learning system, and it ensures that relevance day to day.
What does this mean for those clients that we see? One of the things, and this will focus on what it means not only for the employee, but also for the employer. When they look at those improvements in depression scores, dropping a risk level, if you take somebody lowering their diabetes from out of control to controlled, that it brings down the cost of diabetes medications, but it also brings down their anxiety and stress and allows them to be more focused when they are at work. So we want to give you cost savings, but there's obviously a return on investment. And one of the biggest pieces here is the care diversion. A lot of our clients, because they don't understand the system, will use the emergency room as their form of a doctor visit. Sometimes it's not necessary. So if we can divert them and help them understand where to go to, we can stop that catastrophic event of them going to the emergency room, which, as you know, that cost on an average is about $2,500 spread between the employer and the employee. So reducing that by 13% brings a significant savings both to the employee but also to the employer. And we look to demonstrate a return of investment of 1.5 to 2 times of what you're investing in your medical and pharmacy cost, because we're reducing the amount of meds they're taking, we're getting them the right service at the right time. We have a lot of people that come in and they said, well, yeah, I heard I did have diabetes, but I didn't feel anything, so I didn't do anything about it. Well, now that they have somebody that they can speak to and understand what that means, they find ways to reduce those risks. And Sarah talked about our biggest changer program. And this is over a 12-week period, but on average, they're losing about 16 pounds in that. We had a group in the Dallas, Texas area, and it was a larger facility, but over that 12-week period, they lost almost 600 pounds combined. So that's a significant weight loss for one facility because they got excited about it, and a lot of people invested in it, and it brought a change to the whole community.
What do these numbers look like in a real experience? I'm going to share a real example and outcome from one of the employees who enrolled in Salud through a California employer. It was a 47-year-old male, and very similar to Luis, kind of just wasn't feeling well. So it starts with, before Mi Salud, he, just noticed he wasn't feeling bad. And we had our, kind of things lined up. We had our on-site onboarding. And so he showed up to our on-site onboarding saying, I'm just feeling bad. He had basic health literacy and no regular medical visits. We do, again, those labs that are drawn on site during that process came back and they showed and indicated a diagnosis of type 2 diabetes with an A1C level at 13.6%. Another piece to this is, we have health coaches and we also have mental health coaches. I oversee the mental health coach team as well. And so we understand this integrated approach. It's beyond just, hey, let's give you your lab results back. Oh, you got to do better. We got to, figure this out. Let's tailor a plan. But it's understanding that there's an emotional impact. This person walked in, they're feeling bad, but now they have a whole new chronic diagnosis that they didn't have before, and they're going to have lifestyle changes they're going to have to navigate that they didn't have to do before. And so we understand that we have to navigate that uncertainty, the shock, the emotions that come up with that in order to increase engagement and adherence as well. We also understand we have to look at additional stressors. There were things that were factoring into his health, such as a recent family loss. And then we also understand the most important piece is understanding the motivation. We can give all the recommendations to take care of yourself and, just for the sake of taking care of yourself. But if we're not connected to that person's actual motivation, again, we're going to have that gap in adherence and engagement. So for this person, motivation was family and modeling that healthy behavior to his family. And so when he got connected to Mi Salud, we were able to provide diabetes education and guidance, insulin and metformin prescription, because in addition to our health coaches, we also have U.S. physicians who are able to, our health coaches, say, hey, this person needs a prescription for, or you need to review this case, and can you get them connected to support? They can review the case. They provide that prescription for insulin, metformin. We even help them navigate, the cost or where to go, or you can navigate those pieces as well when needed. And then he was also connected to healthier meal plans, exercise, glucose monitoring, and family co-engagement. And so after all of this, we saw, improved diabetes understanding. He had a glucose monitoring plan and was engaging in adjusted meals, cardio, weightlifting according to those glucose results. So doing, he had his medicine, but he also had all these preventative health things that he was actively engaging in. It wasn't just about the medication. And the results, told the story. 3 months later at a primary care visit, his A1C level dropped to 5.9%. And he was able to stop insulin. So he was now on metformin alone, which, as a healthcare person, I'm excited just when someone's healthy. But from a savings perspective, an employer isn't having to pay for his insulin anymore because Misalud was able to help him engage in all these preventative care measures and understand that it's beyond just giving him the recommendations. We had to understand the stressors, the motivation, and really kind of do this holistic wraparound to support him. And we're able to connect him to our grief program for additional support. So what is the key to our success? Here are the 3 pillars of activation and engagement that we have developed and the learnings from over the past 5 years. Power of hybrid care. So, the digital offers convenience. And with that, we're able to build initial trust and break the ice, overcome technology barriers directly, and establish health baselines. AI as the adherence accelerator. So we use it creatively to simplify and contextualize the doctor's orders, and really making sure it's easier to follow and integrate in daily life. And clinician culture is non-negotiable. So it's not enough to be fluent in Spanish. Clinicians really must understand the cultural pieces like diet, family, work, stress, and stigma to really build that deep trust.
And now, how can you as a broker get involved in this? And we've got a couple different ways here. The 3 opportunities of getting an employer group onto Misalud. There's the direct client per employee per month. We have a plan and it scales based on the size of the group, but it allows them to pay a per employee per month fee. This is a high value addition to any benefits package. One that we have seen come up recently is the broker funded value add. We have had brokers that have decided to purchase Misalud themselves and then give that to their clients as a way of saying, this is an add-on that I know you'll need, and I think it will be very useful for you. They're finding that it more than pays for itself in the end. And then finally, you have those clients that are looking for a claims mitigation tool. And what they see with our return on investment tool is they can drive that care away from the ER, delivering a proven 1.5 times ROI, but it's the most effective way for them to protect their budget. And we all know that budgets become very extreme right now, and looking at how can I keep my costs down so that my premiums aren't going up next year. So if you're interested in taking more steps with Misalud, this is my email address here. There's a QR code here, which will get you to the one-pager about Misalud. We also have a Benefits Ally video that one of our co-founders did, and it's a 3-minute video on why Misalud and what we do. And then we also have information for you, which I'll share on the next screen, of getting our information both in English and in Spanish. But I'll leave this here for a minute, just if you need to do the QR code or you need to take down my email address. I'd love to talk to you and talk about your customers and see how we can be the right solution for them and where we would fit in best. And then these were those 2, the QR codes. One is in English, one is in Spanish, that if you have clients who need something in Spanish and they need a direct piece there, they can read that. And they can also sign up if you have people who said, we want to give this as an opportunity for them to sign up, but we're not paying for it. They can sign up direct as a customer and pay for it themselves. And thank you. We appreciate this time and look forward to answering any questions.
Thanks to both of you. That was great. And what a great overview. A couple things stood out to me, and we talked about some of this when we got together to chat about your presentation, and that is the Spanish speaking contacts that people who use Misalud have. It's different than really having a translator having to go back and forth, right? It's literally cuts that middle person, I guess, out to me, and I think that's really impressive. And the fact by the way, that I wrote down that they also speak English. So the Spanish speaking, therapist, whoever the contact is also speaks English. So that makes the whole process easier, right? Which is great. I loved your AI nutrition agent. I wrote down all 3 segments of that because I thought the fact that you look at it so holistically, right? It isn't just simple. And Sarah, in particular, you in the mental health field, right? Because that,
Mhm.
as you and I talked about earlier, overlays everything at times.
Mhm.
Right? Because somebody, for example, your case study, getting a new diabetes, whether it's type 2, whatever diagnosis, that's overwhelming, right? So there is
Absolutely.
going to be mental health impact. So I thought that was great. Your numbers speak for themselves. That slide was really impressive with the results that you've gotten. And so thank you for sharing that case study, because to me, that really kind of brings it home, right, for folks. So we do have questions. Why don't we go ahead and see how many of the questions we can get through in the couple minutes we have left? And one is, you mentioned PEPM, I know, on one of the slides, but somebody wants more specifics. What does pricing look like for Me Salute?
So we scale our PEPM pricing. We start as low as 50 employees, and then we've got different levels all the way up to over 10,000 employees. So um, it's a scaling range, and then there are also the opportunities to do on-sites and health screenings, which are a separate cost, but we try to work those out geographically so that we're not bouncing back and forth. But if we have a couple different groups that are in a similar area, we can reduce the cost because we'll do a couple groups at the same time. So it reduces the cost of us bringing our health coaches over and setting up our lab and everything. But the pricing will range from anywhere from $4 to $5 PEPM up to about $12 PEPM, depending on the size of the group.
All right. Well, that makes sense. Okay, now here's a good question, because I was thinking the same thing. How does Me Salute compare to other programs available, like as a DPC?
Sarah, do you want me to handle that one, or?
Oh yeah, that'd be great.
Yeah. So we're different than a direct provider group, the DPCs, because we aren't a direct provider clinic is what some people use. They'll have a clinic where they can send people. But the one issue with that is depending on how many Spanish speaking providers that clinic has, it can slow down rates. Then the clinic typically charges a copay to the customer. So your employees are now still paying a copay, and they have limited hours. So with Me Salute, even though they are not seeing somebody face to face, they have the ability to schedule appointments when it fits for them, or to go to the on demand. I need to see somebody now before I go to work because something is making me nervous, or I'm feeling something after work, where they can have an appointment right then. And then we will also help guide them to the right places if they do need more care. If they're in network or they're on the health plan, that we can direct them that way. But if they're not on the health plan, we'll help direct them to the lowest cost places for their care as well.
Great. Okay, I think we have time to squeeze in one more, you guys. So this is a good question too. Does Me Salute replace the regular primary care providers' benefits?
I could take that one. And the answer is we really coordinate with them. We're not trying to replace the primary care benefits. We're trying to enhance engagement. Because the example of Luis was someone who technically had primary care access to primary care resources, but wasn't engaging in them, and probably still needed to go to the primary care clinician. But we're able to do that preventative care, because he can go to the primary care, he can get a diagnosis of diabetes, but it's kind of like, here's your diagnosis, do this, this, and this. And then again, it falls all on him. So we're not going to compete with the primary care, but we're really going to complement and enhance what they're accessing. And so if we had a client like Luis, we would see him and we'd actually encourage him, let's go to your primary care, let's do all of this. You can still come back with us and we're going to do all the preventative care and monitor glucose and make sure that you're managing your health, and even correlate or collaborate with your primary care provider.
Perfect. And look at you. You took us right to the bottom of the hour, Sarah. So good job. I want to again point out Jim's contact info. It's sitting right in front of you. I encourage you to write it down. These guys are really responsive and I know they'd love to hear from you. So thank you to your entire team for working with us and putting on today's presentation. For attendees on the line, of course, we always appreciate you taking time out of your busy schedules to join us. So thank you. With that, we have reached the end of our time together. Again, thank you all for joining us, and we look forward to seeing you on the next Meet a Vendor webinar, actually Wednesday, December 3rd at 1 p.m. Central. Until then, take good care, everyone, and have a great rest of your day and have a nice Thanksgiving.